views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗏𝗏𝗁 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗁. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗁 on 𝗛𝗏𝗹 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗁 every Monday from 5 p.m. to 6:30 p.m. airing on Sky Cable Channel 224 and on all DTT boxes, simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search 𝗛𝗏𝗹 Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗁 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗁. I'm your host, Nicole Jacinto. It is February 12, 2024. Yeah, I keep saying 2023 until now. Sometimes when I write down stuff, I'm like 19. Okay, so anyway, welcome to the show. And today we're going to talk about germline genetic testing. And with us today is Dr. Frances Victoria 𝗏𝗏𝗁. And we've had her on the show before. It was a very, very interesting show, very interesting topic, very informative. Welcome back to the show, Dr. 𝗏𝗏𝗁. How are you?
Hi, Nicole. Good afternoon. Thanks for having me again on the show.
Yeah, of course. It's my pleasure. It's our pleasure. We learned a lot from you last time, and I'm sure we're going to learn a lot from you again today. And I think I owe you a steak. Yeah, I still don't have my crown. So it's taken that long. I haven't gone back to the dentist. They're chasing me down just like my other doctors. But anyway, so today we're going to talk about germline genetic testing. So can I start out by asking you, what exactly is germline genetic testing?
Well, basically, it's testing the DNA that one was born with, no? And it helps to determine if someone has inherited certain faulty or mutated genes or cancer protection genes, no, that basically work in the sense that they protect the person from getting cancer. And if they don't work properly, then the person's not protected, no, from getting cancer. So basically, a germline genetic test will look at these genes that don't work properly and looking at people who aren't protected from getting cancer.
Okay, just to clarify what you said, it tests the genes that are faulty in terms of getting cancer. Do you mean the genes that kind of like shut off the cancer? Or
yes, that's right. So we all have what we call cancer protection genes. No? So everyone has a set of these genes that protect you from getting certain types of cancers. So some people are born with faulty or mutated copies of these genes, so they're not protected from the onset when they're born.
Okay, great, doctor. Can I ask you why it's called germline?
Well, basically, germline cells are what we call like the sperm and all the cells that you were born with. So
Okay.
that's why it's called that.
Okay, so it's the sperm and all the cells you were born with. Does it have anything to do with with being male or female? Is that it? Because it's the X and Y, or
Not necessarily, but it's
okay.
the entire genetic code that you were born with, and there are certain parts of that code that will dictate these genes for cancer. No? So we look at that particular part of the DNA sequence.
Apart from, okay, how is it different from other types of testing? Like you've explained that germline genetic testing is to test whether we have the faulty genes in terms of like turning off. Well, maybe you can talk about how cancer works just a little bit, like an overview. Like we're all born with cancer with genes that, I mean, we're all born with the how do you
Genes
say
that protect us from getting cancer.
Yeah. Like we're predisposed, no?
Yes. So
To
everyone has 2 copies of whatever cancer protection gene. So everyone, assuming they should have proper working genes, right?
Yeah.
But some people are born with copies of these genes that don't work properly. And over their lifetime, if you have one faulty gene, the other gene also gets, the other copy of the gene also gets affected, no, by your lifestyle, diet, etc. And that's how people do form cancer over their lifetime. So people who have this germline genetic predisposition, no, so they have one faulty gene, they already are born with that one maybe handicap, if you can say, na their cancer protection genes don't work from the onset.
Okay, so let's say a person is born with one copy, of course, from the mother and one copy from the father.
Right.
If one of those copies is mutated or doesn't work, then they are more predisposed to getting certain types of cancer. And when you do this germline genetic testing, you can tell if one of the genes is faulty or not. Has it ever happened that both are faulty?
Yes, it's possible, but it's quite rare an occurrence, no? So we don't see it very often. Most people will have one copy of the gene that's faulty or mutated.
Okay. All right. So, why is germline genetic testing done? Like, and how does it, fall into basically preventing cancer, or like, why in your line of work do you do it?
Okay, well, generally it helps to open up treatment options for our cancer patients. Most of the time naman, if you're diagnosed with cancer, no, that's the first thing that you want to think about is, how do I get better? So by doing germline genetic testing for people who meet the criteria for testing, we're able to try to open up treatment options for them. Like, for example, people who have breast cancer and have certain cancer protection genes that are associated with these breast cancer, we are able to give them treatment options like other types of chemotherapy that work better for them. We also have targeted treatments and immunotherapy that might work better for them. There are also ways that we are able to advise on doing prophylactic surgeries, like removal of the breast and ovaries, for example, to be able to decrease their chances of getting cancer in these other organs. So in that sense, it really helps to open up treatment options for the patients. It also helps to at least aid in prognosis, knowing that like your patient, will she do well or not with these treatments, because if you're able to find a matched treatment to their DNA sequence, of course they should do better, assuming that you have these targets, right? And finally, it also helps to identify other family members who might have a risk of getting cancer. So if you have a patient who tests positive for these cancer protection genes that don't work properly, no, we're also able to advise their family members to get tested, and we can give them recommendations on what they can do to reduce the risk of getting cancer.
Okay, great, doctor. So, like, not only does it help the patient, and as you said, prognosis, so it means like what would happen next,
Right.
in terms of like treatment or how the patient will respond. Then it's not only the diagnosis that's covered, but how you treat it. And then I'm sure it would help the siblings, or of the patient who may be predisposed to this as well. Have you ever encountered this? Just curious, have you ever encountered a situation where, let's say, you encountered a patient that, and you did the test, and it turns out that one of the parents, or let's say the father, do you know who they inherited from, whether it's the father or the mother?
Sometimes we have an idea, but sometimes we don't. So it would benefit also to have the parents tested if ever we do find a patient who will test positive for these mutations.
And
It
like
also helps with the extended family kasi, and also letting them know about this information, right?
And then, like, have you ever encountered a patient who, okay, let's say they have cancer or they were diagnosed with it, and then you did the testing, and then, but it didn't exhibit, neither of the parents had cancer, but then you can test them so that later on they don't get it. So
Yes.
goes up
possible.
to the previous generation, how you use this to help. Okay, thank you, doctor. You did, can I ask you, you did mention it helps in certain types of cancer. Can you give us like some of the types of cancer that it helps in? I'm assuming breast, you mentioned that, and what other, just so we have an idea of
Well, in general, the most common types of cancers that we see that would have these mutations would be breast cancer because it's a very common type of cancer, right? And for certain genes, like genes called BRCA1 and BRCA2, these are associated with breast cancer, ovarian cancer, pancreatic cancer, and prostate cancer. And by knowing this information, if someone has these BRCA mutations, it helps to open up the treatment options for people who have those four types of cancers. For breast cancer, it helps in determining whether you can add on a certain chemo drug, platinum containing chemo drugs, which assuming you have these mutations, people respond better. There are also drugs called PARP inhibitors, such as olaparib, that also will be a better option for people who have these BRCA mutations, and they can be given as maintenance for people who have breast, ovarian, pancreatic, and prostate cancers. So they all are able to benefit from that information. Other types of cancers that are associated with hereditary predisposition, we also have what we call Lynch syndrome or hereditary non-polyposis colorectal cancer. So hereditary colorectal cancer. For these patients, we do advise testing, and we see that it's associated with an increased risk of colon, rectal, and uterine cancer, among other types of cancers. And people who have this Lynch syndrome genes that don't work properly will respond better to certain drugs like immunotherapy. So that also helps in determining really the treatment options for these people who have these different syndromes.
So one of the best things about germline testing, germline genetic testing that I understand is that it doesn't just help to see if you're predisposed to it. It helps in determining the actual treatment that target what you have and can really help you recover from it or treat it, and that's pretty great. Instead of
When I talk to my patients now about doing this germline genetic testing, that's actually the first thing that I try to emphasize, because people always think about like inherited cancers, it's gonna benefit my children but not me, right? But I always try to emphasize that, because right now we're able to have all these targeted treatments, immunotherapy, which patients would respond better to once have that matched DNA sequence. So it really helps to do these tests to determine treatment options for the ones who have already been diagnosed.
You've mentioned immunotherapy quite a bit. Can we talk a little bit about that? Like, what exactly is immunotherapy? Even if you just give us an overview and choose a certain type of cancer, let's say.
Sure. There are several drugs available right now that fall into that class of immunotherapy, but basically it targets the immune cells of the body and make them fight the cancer cells. So they're targeted in that sense, and also people hear about chemo, they get so stressed out, and because it really does have a bad rep in terms of side effects and stuff. So people are more maybe okay to get immunotherapy, right, or targeted treatment. So immunotherapy is also an IV drug, supposedly with less side effects. So at least it's more tolerable compared to most of what we hear about now from chemotherapy. The most common immunotherapy drug that we have available is called pembrolizumab, and it's actually used to treat a wide range of cancers. And some of these cancers are those that are associated with hereditary predisposition. It's used to treat men metastatic breast cancer. Also, for those who have more advanced stages like stage 2 or 3, triple negative breast cancer. It's also used to treat colorectal cancers as well. So there are really a lot of indications for it. And doing these genetic tests now will also see whether a patient would respond well to these drugs.
Okay. And then, okay, so of course there are patients who will jump the gun, no, and say, "Well, I want that treatment already." What is like, well, I want that immunotherapy treatment already. Even if I'm in like, stage 1 or we're not certain, why don't you give that to patients who have like, or, maybe all types of cancer, or like who, let's say they have it and they say, "I want this." Why is the testing necessary? And what are the, I guess, the consequences, or, the how do we say this? How do I say this? Like the undesired consequences of jumping the gun and insisting that you get the immunotherapy before getting the germline testing?
Well, first of all, it's important not to find out if you'll actually respond to the drug or not. So by doing the test, that will help guide you whether you do need it or not. Okay, so that's the first thing. Well, another thing about jumping the gun and all, well, immunotherapy is quite expensive, so I don't think that's something that people will rush into if they knew the price, no? So we really have to choose the patients who will actually benefit from the drug, and also, of course, avoid, possible side effects by giving a drug that isn't needed.
Yes. And okay, and then is immunotherapy the same as gene therapy?
No, it's not.
No, okay. Good. Thank you for that. I'm like so lost here, but I just had to ask because we hear about gene therapy, this and that, and immunotherapy. So thank you for clearing that up for me. Okay, doctor, you did mention earlier the BRCA gene. Of course, we've had a bit of this conversation in the past, but you also did mention that germline testing and because mostly when you think of the BRCA gene, we know about the breast cancer because of Angelina Jolie, whom you said is, your poster girl, and then we know about okay, so that's related to the ovarian. But you did mention prostate cancer, so that's males. Also, is the BRCA gene somehow, can it be found in males? Is that an indication, or yeah?
Yes, definitely. No. So, I mean, we all have parents, so mom and dad. So we can get the BRCA gene from either one of them, So, definitely, the BRCA gene can also manifest in males, although they don't manifest as often compared to females. Well, because breast cancer is really quite common. Well, ovarian cancer, not as much, but we do see a lot of breast cancers. And I think that's why the spotlight is more focused on that, diba? But for males, we do see people who get prostate cancer younger than usual. Males usually get it when they're older, like maybe 70s, 80s. If we see someone who's had prostate cancer in their 50s or something like that, that's one indication to do testing and suspect that someone has this BRCA mutations. And also, we do see, quite rarely, but we do see people or males getting breast cancer. And anyone who has breast cancer is advised to do genetic testing because there's a high probability that they have a mutation.
I mean, we tend to forget that males also have breasts. They just don't look.
Yes, it's possible, no, that they get breast cancer as well. Right? So because they're not exempted, they can get this.
Yes, okay. So doctor, in your practice, in your experience, who have you seen more and who have done more of the germline testing, who have benefited from it? Males or females, or certain age range, or a group?
Well, in general, I would advise testing for someone who's been diagnosed with cancer at a young age. So I see a lot of young patients. Young is defined as like 50 and below. But if you see someone 45, 40, 30s, 20s, definitely, So the younger a person is diagnosed with cancer, especially like breast cancer, ovarian cancer, these are really indications that they should do testing. We also advise testing for people who have what we call multiple primary cancers. For example, someone who has both breast cancer and ovarian cancer. So that's an indication to do testing. Aside from that, we also advise testing for people who would show a strong family history of cancer. So if you see like several sisters, no, and they all have breast cancer, and a bunch of them has ovarian cancer, and their parents also have it, and the same. No? So we would also definitely advise testing for them. We also advise testing for those who have rare tumor types. So there are certain types of tumors that tell us that you should do testing. I mentioned already, any male with breast cancer, you should do testing. Actually, all people who have ovarian cancer should also be tested. It's not that common, no? So we should also do testing for them. We also do testing for those who have a certain type of breast cancer that we call triple negative breast cancer, that is more associated with genetic mutations. And for other cancers like colorectal cancer or endometrial cancer that have a certain protein expression called DMMR, or deficient mismatch repair protein. So that's a special test that they do on the tumor specimen. And so if people manifest that, it's also indication to do testing. So there are really different or a lot of indications to do genetic testing. But just to summarize what I said, it would be four things. Now, first, someone diagnosed with cancer at a young age, someone with multiple primary cancers, someone with a strong family history of cancer, and those who have rare tumor types.
Okay, great. So that's those who get cancer at a young age or manifest cancer at a young age, those who have multiple primary cancers, those who, I'm sorry, the last two.
From family history of cancer,
History of
and
cancer.
those who have rare tumor types.
Rare tumor types. Okay, thank you, doctor. So, okay, that's great. And then, so would you consider these people like qualified, or they should definitely get the germline testing, or are there some patients where, they should get it? I mean, what are the qualifications, or do people have to qualify for it in a certain way, like in terms of their health, or do you say, no, you shouldn't get it because you only have this, I mean, how does that go?
In general, those people who would meet those four things that I told you about, I would recommend testing for them. There are certain situations that maybe like you see a patient who has such a high level of anxiety or doesn't want to know. Of course, you don't want to push it on or like ask them to do it if they really don't want to, right? But in general, most people will go ahead and do the test if you recommend it to them. So
Okay. Okay. So, doctor, high level of anxiety. Why don't you push it? I mean, of course, you never push a treatment on a patient. It's up to them. But why is that one of the things that comes up why is it high level anxiety? Is it simply because they have cancer and they're anxious about it, or do they start having other problems? Or I guess in other words, I mean, are there other criteria that, like, do they have to have a certain, what's the test like? Does the test itself make them anxious? Or
well, some people will have this much information and get so stressed about it, right? So if you don't want to know, that's also okay. But in general, I would advise testing because it really helps, no, and at least guiding your treatment. What are your options? How well will you do? It may benefit also your family members. So I'd say, there are a lot of more positives than
then
negatives, I would think so. But yeah, if a patient has too much stress or they don't accept that information, of course, you don't push it on them.
okay, great, doctor. Okay, so in terms of considering things to consider before you undergo testing, I suppose the level of anxiety would be one of them, and of course, all the things you mentioned, like if you have those four, if you fall into any of those four categories that you mentioned earlier, or you have the type of cancer that usually you can do germline testing on, and it proves to be successful, and not just in terms of diagnosing you and perhaps preventing your other family members from getting it, or just giving them a warning, but that they may or may not manifest later on, but the treatment, the way it's treated, which is targeted, what are some things that people should consider before getting the, I know it's advisable, but what should they consider all in all before
Well, I
getting?
think the first thing would be like how much information they're prepared to know about. No? So I think if you just explain it well and really
Yeah.
try to tell them what the benefits would be for themselves and the patients, especially because we know that it does help no in designing a better treatment plan. So I think that's really quite important. No, how much information do you want to know? Again, I mentioned well there is a psychological effect for certain people, a high level of anxiety. Of course, you don't want to throw something at them that they're not prepared to know about. No? So that's another thing to consider. Another thing that we have to consider, especially in the Philippines, is the cost of the tests. No? Of course, this is not something that's readily, available, or it's not exactly cheap, right? So they also have to be aware about the costs, maybe insurance implications. No? So these are things that they really should be aware about.
When you mentioned insurance implications, does that mean that they have to inform their insurance if they got the testing? I mean, what if someone doesn't have cancer, but their family member does, and they want to do the, the testing, the germline testing, and perhaps
Well,
they pay for it on their own, but okay, sige, what?
Yeah, I'd say that's a bit of a gray area right now in the Philippines because, well, people aren't really very aware that these tests are available already, right? I mean, we really have to up the education of doctors and patients that there is such a thing. Now, in other countries like US, Singapore, they do have laws now that prevent the insurance companies from asking for your genetic test results to determine the premiums that you pay. And that helps to prevent like discrimination, what we call genetic discrimination. So generally, insurance companies actually don't ask naman that information. It's not really allowed. But they will base the premiums that you pay on the family history. So that's what makes the insurance payments a little bit higher if ever you do have a strong family history. But again, they're not supposed to deny you from getting
Yeah.
insurance to have these genetic mutations.
I wonder if people ever ask insurance, let's look at your history. Are you genetically predisposed to being ugly? Like, of course, everyone be in uproar, like, what the hell is that, right? But so, let's not discriminate when it comes to actual diseases and illnesses. So, okay. Yeah, okay. And here, it's a gray area because we don't have any laws preventing people from getting information and all of that.
Exactly. But yeah, I mean, if you base it on what other countries are doing, no, we shouldn't discriminate based on this.
But we embrace it on morality as well. We shouldn't discriminate.
Yeah,
That's
definitely.
what we're here
Yeah.
for. I mean, insurance also makes it's a bet that they take. And a lot of people, they make more on the people who don't get sick. So there. Okay. Well, okay. Insurance companies, please still sponsor me, please, if you want. Okay. Thank you, doctor. Okay. We're just going to take a short break, doctor. And when we get back, folks, let's talk more about, the actual process of getting the germline genetic testing. And of course, Dr. Ke will explain that to us. So we'll be right back. We'll just take a short break. Stay tuned to Healthline with Makati Med. I'm your host, Nicole Jacinto. We're here with Dr. Francis Victoria Ke, whom I owe a steak. And then you can get me another one. Then we just keep eating steak all over, which may not be good for your health completely, but we'll just do it once in a while. Okay. Thanks, guys. Stay tuned to Healthline with Makati Med.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Gia Season from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗠𝗸𝗁𝗵𝗹𝗁. Available for outpatient care services, our 𝗠𝗸𝗁𝗵𝗹𝗁 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗠𝗸𝗁𝗵𝗹𝗁 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗠𝗸𝗁𝗵𝗹𝗁 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗠𝗸𝗁𝗵𝗹𝗁.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med. I was a little short. I did not know that my mic was off. Okay. Welcome back, folks, and thank you for watching. And Doc, before we talk about the rest of the stuff, we actually have a question from Isabella of Makati. Okay. Isabella's asking, what age should we get tested for cancer? Well, okay, maybe we can go through again, like the, I guess, like how young is, you can tell us again, like what young is, or, you know, like, first of all, the qualifications or the kind of, if you have a certain kind of cancer. I guess it's a good question, Isabella, because, you know, like, what if you don't have it yet, but you see others around you?
Right.
What's, you know, or your family members, if it's familial, what is the youngest age that you can get tested, germline testing for the types of cancers that you mentioned?
All right. So just going through the criteria again. So I mentioned 4 things. We usually will advise testing for people who have been diagnosed with cancer at a young age. That's 50 and below. Those who have multiple primary cancers, those who have a strong family history of cancer, and those who have rare tumor types. In general, we would advise to start off testing with someone who's already diagnosed with cancer, because there are limitations on testing someone who doesn't have cancer yet.
All right.
Or doesn't have cancer at all. So in general, yes, we would test first this person or the family member who's already been diagnosed. And then if we find something, that's the time that we advise testing for their family members who don't have cancer
Okay.
And with regards to the age, no, if you don't have cancer, but you have a family member who has a known mutation in whatever cancer protection gene, generally we do testing if you're of legal age na. So 18 and above, because you need to make your own decision, no, on doing the test. So we usually don't test children unless they have certain hereditary cancer predisposition that shows up in children, but it's not as common.
So basically, if you already see a predisposition in a child, and the parent, or maybe the child even got diagnosed with something, no, and then the parent maybe also has it, or the parent says, "I really want my kid to get tested," you would agree to that?
Yes, that's right.
Okay.
So there are certain indications that we test kids, no,
Mhm.
for these genetic predispositions, particularly for cancer, no. There are certain syndromes, like for example, 𝗛𝗲𝗹𝗁 syndrome that predisposes to sarcomas or bone cancer in kids. It's quite common, no, among children. Those would probably be indications for testing them. Otherwise, we wait for someone to be of legal age to do the genetic test.
Okay, because as you said, it should be the patient's decision, no?
Correct.
Okay. So wait, okay, so basically here for medical stuff, legal age is 18.
In the Philippines,
In the
yes.
Philippines, yes. So it's here, I'm like, here. Where is here? On the internet. Okay, thank you for clarifying that, doctor. For medical stuff, it's 18.
Yes.
I forgot what it is for voting, which is
18.
ironic. 18 also, okay, which is really ironic. At just this moment, it's really just really ironic. But we have this, okay, and how, and then I'm asking, legal age for marriage, I don't, it's a very nebulous thing, because I think it's 19 or 18, but if you're of a certain,
Actually, I have no idea. I
I
think
know it's about 18 or 19, but if you're of a certain, um, I
age
guess,
of emancipation, and if you make
yeah,
your own money or something like that. Yeah.
yeah.
Go
It
younger.
can actually be lower if you're a certain faith or a certain cultural background. It can be lower because in certain cultures that we have here in our tribal cultures, like people tend to get married earlier. So I'm just like, okay, or maybe they're married off. You can get married, but you can't get your own. You can't decide if you can for yourself if you can get the genetic testing, and you can't
Right.
do
I
that.
mean, I'm sure there are certain exceptions, no, but
Yeah,
generally, I'd say 18.
yeah. Okay. And I wonder what the legal drinking age is, because I'm sure we never stuck to it. Never mind. Let's not, put too many laws out there that control whatever. Okay, so thank you, doctor. Thank you for that question, Isabella. It brought a lot more to the conversation. Okay, so doctor, when it comes to germline genetic testing, can you give us an idea, or tell us, walk us through the process of how it's done?
Right. So usually, if someone's diagnosed with cancer, now they'll see a surgeon or a medical oncologist. Usually, those would be the first people that they see. No? And of course, it really depends on the person that saw the patient. But if they're familiar with the guidelines, they should be referring these patients if they meet the criteria for genetic testing, right? So let's say the patients get referred to the genetics clinic. What we usually do is what we call, first of all, a pre-test consultation or pre-test counseling. So that's when we go through the patient's personal history of cancer and family history of cancer, going into really a lot of detail, no, into those things, and seeing whether they actually need to do testing or not. And if they do, we can offer them the test options, and make them decide, no, if they want to go ahead with the test. If they are ready for it, we obtain informed consent, and we collect specimens to do the testing on. The specimens, we usually will collect blood or saliva. And right now, there are several labs around the world. There are also some local labs that do testing. No? So in my practice, I usually will send out to a lab in the US, and I get results in about 2 to 4 weeks' time. So that's the testing itself is done. So I usually will get the results in 2 to 4 weeks time, after which I will meet with the patient again and do what we call a post-test consultation or counseling, no, where we go through the test results, we go through the recommendations for the patient and family members, and we'll basically answer any questions. With that, now with the recommendations, I will refer back to the attending physician, so the surgeon or the medical oncologist, for example, and give them recommendations. Hey, this is maybe how you can modify the treatment for the patient. These are the recommendations for them. Additional tests that they might need to do, whatever else, now prophylactic surgeries. These are the recommendations, blah blah. So we would give that guidance, no, to the doctors and the patient, and well, for patients who would test positive or have uncertain results, we usually will keep them on follow-up and just to make sure that they actually do what needs to be done in terms of like their monitoring and treatment. So,
So,
yeah, basically that's it.
So it's not too painful. It's saliva or blood. It takes some time to get the results because you do send it out. Like you personally send it out to a lab in the States. The labs here, do they take long as well? They do.
It depends where, but I think it should take about the same amount of time, about 2 to 4 weeks as well.
Yeah, okay. And then you have the pre-counseling and then you have the actual doing of the test. If if they decide and you decide, okay, it's worth it, let's do the test. And then the post-counseling, and then you do make recommendations to their attending physician, whether it's a surgeon or the oncologist. And when you do this, doctor, do you also like encounter patients who are very anxious like yourself? Do you work with anyone else aside? I know you can calm patients down, but are there any other like team members that you work with in terms of this, let's say psychiatrist or psychologist? Does that ever come in during the process of the testing?
Yes, for sure. No. So if a patient needs support, emotionally, psychologically, we can always refer to someone who is able to counsel for patients who have been diagnosed with cancer. So we do have onco psychiatrists. No? So they're able to really, delve into the issues of most cancer patients. So we can help.
That's great. That's great. So not only if you've been, not only for the testing, but if you've been diagnosed with it. And do you find that some patients who want to get tested or, decide to do the testing, but have not been diagnosed with cancer yet, also go through these rough patches where they ask you for a therapist or a counselor or a psychiatrist also, or, because of
Yeah,
them?
I would think that's something that happens as well, but probably not too common.
Yeah, not the common. It's once they're diagnosed.
Yes, yes.
Okay. All right. Okay. Thank you, doctor, for answering that question. How do is there a risk reduction plan that you develop, that your team develops, or perhaps the other team develops? Like, and how do different healthcare workers collaborate on that?
Yeah, so for example, for someone who has a BRCA1 or 2 mutation, we would advise them on certain things to do. So in terms of screening, like we would advise them to do, for example, mammograms on top of breast MRI as well. So we usually will advise patients who have BRCA mutations to start doing breast cancer screening younger at age 25 compared to age 40, which is for general population na all females should be doing mammograms annually from age 40. So we start younger, age 25, we do mammograms, and we usually will do breast MRI as well. Aside from that, we also can advise na to do prophylactic surgery for people who have BRCA1 and 2 mutations, like Angelina Jolie. So again, as the perennial example for these things. So she decided to do a bilateral mastectomy and removal of the ovaries and fallopian tubes. So that's an option to offer patients who have these mutations because it offers a very great risk reduction, about 90% risk reduction in the risk of getting breast and ovarian cancer. So by doing these procedures, at least you cut down your risk by that much, right? So it's an option for patients to do that. We also have guidelines, no, for men. We mentioned earlier, diba, breast cancer in men, prostate cancer in men. There are also recommendations on how to screen, like doing PSA monitoring. It's a tumor marker, a blood test, no, and a digital rectal exam, which is done by a urologist. And we also can do a physical examination for breast cancer for males. It's easy to do a physical examination because they're not supposed to have lumps in their breasts anyway. And for those who are a bit on the heavier side, they may actually use mammograms or as screening tools as well.
Ah, yes,
So,
the men are a
kind
bit
of ways.
like sort of man boobs. Yeah. Yeah.
Yeah, true.
That's not an insult. It's just what people call it. Okay. Yeah. Okay. Doctor. Okay. So the prophylactic surgery, you answered that question already. It entails like what Angelina Jolie did, which is to have a bilateral. So it means both her breasts, she had a mastectomy, she had them removed. And then also her ovaries and her fallopian tubes. Because as you said, it reduces the chance of getting the cancer by 90%. And I believe her mother had it and, passed away from
Right.
it. And then also, what's your basic opinion on, because some people will say, I don't want to get a breast implant, or I do after I get a mastectomy, because we've heard so many things about breast implants, like for many years, like, oh, if you're sick already, why put one in? It can actually cause it and things like that. I mean, I know it's not your specialty, you're not a plastic surgeon, but do you see a lot of patients who, when they get the mastectomy or mastectomies, I mean, or the either one or two, they already put an implant in? Is that okay with a person like you who's versed in
Yes.
that? Yeah.
Definitely, no, there are options to do that. So we do have options of doing like a mastectomy with breast reconstruction. And I do see a lot of patients who opt to have that done these days, no? And that's perfectly fine, whatever makes you feel better about your body. If you remove totally or you put in an implant there, as long as you're getting the proper treatments, that's okay.
When it comes to the men, have you seen a lot of men get mastectomies? I mean,
To be honest, no, we don't see a lot of people or a lot of men getting breast cancer. I think maybe I've been in oncology for, oh my gosh, I don't want to say 10 years, no. So I've probably seen
let's say 5. No, I'm just kidding. 10 years, because your experience
five.
started when you were 12.
And I would think I've only seen about maybe 3 men who have breast cancer. It's that rare, but it doesn't happen na parang, it's a possibility, So you have to really keep an eye out for these men. And if you see someone who will manifest with breast cancer, definitely you have to advise testing for them.
Now for prostate cancer, what's the what would be the equivalent of prophylactic surgery for that?
Oh, we don't have recommendations for men not to do prophylactic removal of the prostates. No? So we don't have that recommendation.
You don't have
But
that.
we do have screening recommendations. So by doing a blood test called prostate-specific antigen, or PSA, which is a tumor marker, and also doing a physical examination or digital rectal examination. That's one of the ways that we are able to screen.
But are prostates removed at times?
Yes, if they actually get prostate cancer, yes, it is
Okay.
one of the treatment options.
Yes. Okay. And is there something to that? Because if your prostate is removed, I mean, can can men still have, can they still get erections?
Yes, but there might be some difficulty, having that.
Okay. All right. So that's actually what I was aiming for, because a lot of men don't want to get it done because they don't want to get,
That's
well,
right.
I-
Anyway, Yeah,
Mm.
there are a lot of options now. For example, if someone is diagnosed with prostate cancer, there are a lot of ways on how to treat. There's what we call active surveillance. There is something that's minimally invasive. You can go for surgeries. You can go for radiation. So it really depends on what the patient would be amenable to, and
Mhm.
we can always design a treatment plan based on that.
All right. Thank you, doctor. Okay. Doctor, how long has germline genetic testing been around, like all over the world? When,
I would say probably since the late 1990s, no? So the
okay.
BRCA genes were discovered around that time. It became a little bit more mainstream maybe in the last 10, 15 years. In the Philippines, local testing was available from maybe 2016, thereabouts, no? So yeah, it's been around for a while.
Would you consider that, okay, it's been around for a while, but would you consider its presence in the Philippines or availability rather new, or, it's okay, it's pretty standard also here,
I
just
would
not.
say it's still probably new because we really have to create no awareness among doctors and patients, definitely, because it's not something that we talk about all the time, or it's not
Yeah.
really very mainstream. No, most people will not be familiar with genetic testing, what it's for. No, so definitely we have to up the awareness about this.
Okay. So, it's kind of new because people are not aware. Even doctors themselves are not aware. It's not the first thing that comes to mind when it comes to treatment, and that the costs are a little bit higher here, or high for us, and then what are there other you know is there any other type of limitation aside from awareness when it comes to getting people to get germline testing, or to consider it, even in
Well,
terms.
I would say the biggest limitation is really awareness, no, education about it, genetics. No? So, it's something that we really have to do a lot about. It's a bit hard because, considering like how many experts there are in the Philippines, are not a lot. No? So, of course, it's hard to get the news out. Aside from that, one big limitation is cost. No? So, when we started doing genetic testing locally, to test for just BRCA1 and 2, um, at that time was about 200,000 to test those two genes. So it was, I mean, definitely it's quite prohibitive in terms of, cost and accessibility, because not a lot of people will be able to afford 200,000 to test for those two genes. But definitely right now, because it's becoming more mainstream, there are a lot more companies that offer these tests. So the prices have gone down significantly. And I would say that it's more accessible now in terms of cost, but it's still a bit expensive. No?
Yeah.
So not something that the average Filipino will be able to afford. So yeah, definitely cost is an issue.
Have you ever had a patient come to you and say, I was trying to get help from government agencies, like, this and that usually give, this government agency that give, they give funds to help for, even tests or medication or anything, and say they didn't want to give me? Have you ever had?
Not for genetic testing per se, but in terms of getting treated for cancer, that happens very often.
They don't. You have had patients come to you who say that they refused? Oh, like over the years, they refused? Okay, that is quite shocking. Okay.
Sadly, that's the reality though for most patients that we encounter.
I mean, everybody needs a little help.
Definitely.
Everybody needs a little help. Okay. So, all right, doctor. Well, is there, I mean, what advice can you give to people who are considering undergoing, or, getting germline genetic testing?
I would say just like, be aware of any changes in your body. And if you have signs or symptoms of cancer, definitely go see your doctor immediately first. If you notice anything unusual, that's if you don't have cancer at this point. But for someone who's already been diagnosed with cancer, it's important to know what your options are. If you think you meet the criteria for testing and no one has mentioned that to you, you can always ask your doctor, and you can always come see us no, in Makati Med. We can always talk about whether you need testing or not. No? So I would suggest, knowing really your own personal history, and definitely also knowing your family history, because it's quite important to know what's going on with the rest of the family, no? Because it might also help determine whether you might need testing or not.
Okay, so like if you've been like, if you have a family rift and you haven't spoken to someone for 20 years, you should try to call and say, hey, I just need to know, is this happening to you?
Well, that's something that would be nice. No? Yeah, but yeah, it does
Yeah.
happen.
Have you ever dealt with patients who like you recommended the testing, but they cannot because they don't know their own family history, like they're adopted? And have you encountered people who
Yes, that happens as well. No, so for people who are adopted, and just basing on their clinical criteria, for example, they were diagnosed with cancer, young age, rare types of tumors. I mean, regardless of family history, you would actually advise testing. So, given that the family history is also
already?
unknown, it's a bit hard not to make decisions, or at least the calculation models that we use now to see what's your risk of actually testing positive. That's a little bit limited for someone who doesn't know their family history. But regardless, if you've been diagnosed with cancer, you meet the other criteria, we would still advise testing.
Yeah, because then you would know the treatment if it's
Exactly.
more targeted. Okay. Thank you, doctor. I think that is all the time we have for today. But anything else you want to say? Anything you want to plugs for more awareness and all of that? Please just go ahead and and let it loose. Apparently, we still have more time for today. Okay, so what do you want to talk about? Like dinner? No, I'm just kidding. I
I
got
think
the
it's
wrong. I
great.
misinterpreted the hand signal. I was like, what? Okay. You got
Well,
your hand signal straight here.
yeah, I would say, I mean, if you do meet the criteria, I just want to emphasize it again. Someone who has been diagnosed with cancer at a young age, someone who has multiple primary cancers, someone with a strong family history of cancer, those with rare tumor types. I think it's important. No, please talk to your doctor about it if you haven't even heard about genetic testing. It's very important because it really helps to open up treatment options, and also helps to identify other family members, no, who might have a risk of getting cancer. I think at this point we would really want to emphasize that definitely health is wealth, and if you have that information beforehand, no, you know your risks, you can do something about it. So I think that's also one thing that's very important, is being proactive about your health, and knowing this information will help.
Thank you, doctor. That's a great message to put out there, and it really should be done. Do you do you do you have any kind of like lectures or seminars, or things where people can get more informed, and or like even for doctors, do you find that you have this and other doctors attend it as well? Do you have those kind of things, or
Yeah, we do have like lectures and workshops, no, for doctors. I think, well, for patients, it's something that I'd like to work on more. I wish I had more time. But every time I do see a patient who comes in for a genetic testing, we do counseling, and I tell them pretty much all the details that they need to know before going for the test, and what they need to know after when they get the results. So yeah, I think basically that's it, no?
Mhm. Okay, thank you, doctor. Is there anyone you'd like to say hi to,
Oh,
or
I want to say hi to my mom
Oh,
and my
okay.
tita Sonny.
Okay, hello to your mom and Tita Sonia. I'm so glad to have you back on the show today, and
Thank you.
I hope you come back and we talk more about your specialty. I mean, see, we've taken two topics, so I'm sure there's more. And let's do this. Let's help do this more often. Raise awareness for your advocacies, your cause, your specialty, and hi to your mom. raised a good kid here. Okay. Thank you, doctor. And thank you, audience, for watching. Tune in again next week for Healthline with Makati Med. You're here with the fantastic Francis Victoria-𝗶, Dr. Francis Victoria-𝗶, and I'm your host, Nicole Jacinto. We'll be back next week with more on Healthline with Makati Med. Take care. Namaste.
Thank you.
Thank you. Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.